So what is this invisible enemy we call canine distemper? It is caused by a virus, a tiny germ that is related to the measles virus in humans. But don't worry, this virus cannot spread to people. It is a canine problem. This virus is very contagious, meaning it spreads easily from one animal to another. The most common way it travels is through the air. When an infected dog coughs or sneezes, it releases tiny droplets into the air, and these droplets carry the virus. Another dog can simply breathe in these droplets and become infected. It's that simple and that fast, which is why it can spread so quickly in places where dogs gather. The virus is also shed in other bodily fluids. This includes urine, blood, and saliva from an infected animal. This means that shared food and water bowls can become a source of infection. If a healthy dog uses a bowl that an infected dog just used, the virus can be passed along. It can also live on objects like toys, bedding, and even the hands or clothing of people who have handled an infected dog. This is why good hygiene is so important. The virus can survive for a little while in the environment, waiting for its next host. It is a sneaky enemy that uses many different paths to find its way into our dogs' bodies. It's also important to know that dogs are not the only animals who can get distemper. This virus can infect a wide range of wildlife. Animals like raccoons, skunks, foxes, and coyotes can all carry and spread the disease. This is a critical point for dog owners who live near wild areas or even in suburbs where these animals are common. An infected raccoon visiting your backyard could leave the virus behind, creating a risk for your dog. Your dog doesn't even need to have direct contact with the wild animal to be exposed. This is why keeping your property clean and discouraging wildlife from visiting is another layer of protection for your pack. The most vulnerable members of our pack are always the puppies. Young dogs, especially those between 3 and 6 months old, are at the highest risk. Their immune systems are still developing and are not strong enough to fight off such a powerful virus. This is also before they have completed their full series of vaccinations. Unvaccinated adult dogs are also in great danger, as are dogs with weakened immune systems from other illnesses. Understanding how this virus moves and who it targets helps us build a stronger defense. It's all about being aware of the environment and the risks it holds for our dogs. As a pack leader, you must be a master of observation. You need to know your dog's normal energy, their normal behavior, so you can spot when something is wrong. The first signs of canine distemper can be easy to miss because they look like other, less serious problems. It often starts with a fever, which might make your dog seem tired or sluggish. You might also see a watery or pus-like discharge coming from their eyes and nose. This is one of the classic early signs. The dog might lose their appetite, stop eating, and start coughing. At this stage, it can look a lot like a simple cold, but it's the beginning of a much more serious battle inside your dog's body. As the virus progresses, the symptoms become more severe and spread to different systems in the body. After the initial signs, many dogs will develop problems with their digestive system. This means they might start vomiting or have diarrhea. This can lead to dehydration and make them feel even weaker. The virus is attacking them from the inside, and you will see their energy completely drain away. They will have no interest in playing or going for walks. They just want to lie down. This is a clear signal that something is very wrong, and it is a cry for help. Your calm, assertive energy is needed most at this time to make the right decision and get them help immediately. In the most severe stages, the distemper virus attacks the nervous system, which includes the brain and spinal cord. This is the most dangerous phase of the illness. You might see the dog start to twitch, as if they have muscle spasms. They might develop what is called a chewing gum fit, where their jaw moves up and down uncontrollably. In more advanced cases, they can have seizures, experience paralysis, or start walking in circles. Their behavior can change dramatically. This neurological damage is often permanent, even if the dog survives. It is a heartbreaking thing to witness, and it shows just how destructive this virus can be to the animal we love. If you see any of these signs, especially a combination of them, you must act fast. Do not wait and hope it gets better. You must take your dog to the veterinarian right away. The vet will listen carefully to the symptoms you describe and perform a full physical examination. To confirm if it is distemper, they will likely need to run some tests. They might take swabs from the dog's eyes or nose, or they could take a blood or urine sample. These samples are then tested in a lab to look for the presence of the virus. A quick and accurate diagnosis is essential. It is the first step toward giving your dog the best possible chance to fight the disease. When a dog is diagnosed with canine distemper, it is a very serious moment. It is important to understand that there is no magic pill or single medicine that can cure the virus itself. The virus must be fought off by the dog's own immune system. So the treatment that veterinarians provide is what we call supportive care. This means we do everything possible to support the dog's body while it fights the battle. This includes giving them fluids to prevent dehydration from vomiting and diarrhea. They may be given medications to control the seizures, vomiting, and other symptoms. Sometimes, they are given antibiotics to prevent other infections from taking hold while their immune system is weak. Caring for a dog with distemper requires a lot of dedication. These dogs are very sick and need intensive nursing care, often in a hospital setting. They need to be kept warm, clean, and comfortable. They must be isolated from all other dogs to prevent the virus from spreading. This is a tough journey for the dog and for the owner. The outcome depends on how strong the dog's immune system is and how early the supportive care was started. Some dogs, with great care, can survive. However, as we discussed, many who survive are left with permanent neurological problems, like muscle twitches or seizures, for the rest of their lives. This is why, when we talk about distemper, the most important word is prevention. We have a powerful tool to protect our dogs, and that is vaccination. The distemper vaccine is one of the core vaccines that every single puppy and dog should have. Puppies need a series of shots to build up their immunity, and adult dogs need regular booster shots to keep that protection strong. Following the vaccination schedule recommended by your veterinarian is the single most effective thing you can do to shield your dog from this disease. It is a simple action that provides a strong defense against a devastating enemy. There is no excuse for not vaccinating your dog. Beyond vaccination, we must also practice good hygiene and common sense. Be careful about where you take your puppy before they are fully vaccinated. Avoid dog parks or other places where many unknown dogs gather. Keep your dog away from wildlife and their droppings. Always wash your hands after petting or handling dogs you don't know. By combining vaccination with these smart, simple rules, you create the safest possible world for your dog. You fulfill your duty as a pack leader. You provide protection, structure, and affection. And by preventing distemper, you ensure your pack stays healthy, balanced, and whole for many